The full-blown pandemic could be ending soon. That declaration came today from Dr. Anthony Fauci in comments he made to the Financial Times. Infections are falling sharply, numbering fewer than 200,000 cases a day for the first time since Christmas. But some places are still being overwhelmed by the Omicron surge. Here's Dr. Jon LaPook.
Karen McCadden is living in limbo.
It's become this really complex dance for me emotionally on getting ready for the surgery. Am I not getting ready for the surgery?
I will count my best work, the thin little book stamped with
McCadden, a 55-year-old poet and English teacher in Vermont, says her scheduled hysterectomy was canceled at the end of December as the state's COVID caseload surged.
What symptoms are you having right now?
I have pain. I wake up, it wakes me up in the night. Sometimes it's pretty excruciating.
Intensive care units in Vermont are currently 3/4 full. And with critical staffing shortages nationwide, hospitals say they have no choice but to delay procedures that are not an emergency. Dartmouth-Hitchcock Health in northern New England has a backlog they call tremendous. In 2021, procedures were booked 2 to 3 months in advance. Now they are being postponed indefinitely.
We know that any delay in a needed procedure has the risk that the situation could get worse.
Dr. Ed Merens is Dartmouth-Hitchcock's chief clinical officer. He says COVID patients sometimes need long hospital stays, and that means fewer available beds.
You know, a normal surgical case might stay in the hospital for 3 or 4 days. We have COVID patients that stay in the hospital 40, 50, 60 days.
Adding to the problem, his hospital has a staff vacancy rate of 25%. McCadden's procedure is now scheduled for the end of February with a different surgeon.
We always imagine that we can take medical care for granted. You know, that if you need surgery, you can go get it. Like, I've never in my life considered maybe it wouldn't be available to me.
A harsh reality as COVID puts increasing strain on our healthcare system. Dr. Jon LaPook, CBS News, New York.